Hi, I'm Kira, and this is my reflection project. So first off, we are supposed to talk about a time when we felt discriminated against, but as a cisgender, heterosexual, white female, I feel like I have not had enough experience with that topic, so I decided to tell a story of one of my friends from St. Lawrence. So he is a black man, and he is a freshman, just like me, and he was walking back from the pizza place, a common pizza place at St. Lawrence, and with a group of his friends. And there were police across the street. And then a group of white people passed by them, and they were like, "Oh, you guys better watch out," and kind of pointed towards the police. And at first my friend was like, "What are they talking about? Like, I don't understand." And then he was like, "Oh, since we're black, like, you see it, you think that it's okay to say, oh, watch out for the police, in relation to, like, black violence, you know." And, he was extremely upset by that, and he was like, "What did you just say?" And, the two girls that were with him was like, "Come on, it's just let it go. Like, you have to let it go." And, when he told me and my friends about this story, we were extremely, like, bothered by it. And so then we ended up taking it to our FYP professor, and we ended up talking about it in our FYP, which was Theater for Social Change. So we frequently talked about oppression and discrimination, and we ended up doing a scene about it, and people would step in and try to change the outcome of what happened to my friends in that situation, and it was actually quite moving and emotional, and we were really glad that, like, someone could tell that this was a problem and that we should change that, even if it wasn't in the moment. So basically that's the story, and now I will be talking to you about COVID-19 and discrimination there. Alright. First of all, I'd like to talk about how COVID-19 started in Wuhan, a large city in a Chinese province called Hubei, in December 2019. Coronaviruses are usually contracted by humans from animals, and that is most likely the origin of COVID-19, but we are still unsure of its exact origin. And this picture right here is a map of China and showing the Hubei province and Wuhan. COVID-19 is an extremely contagious respiratory virus that does not yet have a vaccine. This virus spreads by contact with other people, which made it extremely easy to spread like wildfire and quickly become a global pandemic. The country that was most impacted by the COVID-19 pandemic is the United States, which is what I will be focusing on today. And as you can see in this map, it is very affected at the moment. The U.S. has closed schools, advised people to stay in their homes and limit unnecessary contact with other people, only allow essential workers to continue leaving their homes to go to work, have restricted travel, and made it mandatory to wear facial masks when going outside of the home, and even more safety precautions that I have not mentioned. Now that I have talked about the pandemic, I am going to tell you about the impact of COVID-19 on targeted groups. First of all, I would like to start off with a quote. Throughout reading several articles about how COVID-19 has influenced the United States, I came across this article by George Packer that stated, "The coronavirus didn't break America. It revealed what was already broken," which primarily had me in awe and defeat because I knew it was true. After some thinking, I realized that this quote perfectly exemplifies how the U.S. is being impacted. The U.S. is already an extremely unjust system, and COVID-19 arrived and shined a huge light on these inequalities. Two targeted groups that were extremely impacted by COVID-19 are racial minorities such as black people and lower class people, which is what I will be talking about today. Different racial minorities have been impacted greatly by COVID-19, especially in the workforce. Non-white people are being overrepresented in both essential workers group and in the unemployed group. Due to COVID-19, many people are forced to either stay home and not work at all, or continue working remotely at home, which means online, or for essential workers, risking your health and going to work every single day. The highest unemployment rate goes to the Black race, with 6.7% unemployment rate in the month of March, and only 19.7% of Black workers were able to work online, whereas 29.9% of white workers can work online. Black people and other racial minorities also make up the majority of essential workers that people don't think about as much when they think of essential workers, such as grocery store workers, warehouse workers, Ubers, restaurant workers, and more. Since some Black people and other racial minorities are frequently the ones going out of their homes to work, they are putting themselves and their family members at risk of catching the virus and possibly dying. Also, Black people and other non-white people are more likely to be lower paid workers who interact with others often rather than a CEO who does not need to interact with clients, and this is due solely to the still very present racism in the U.S. before and during the pandemic. Lower class people are also very negatively affected by this pandemic. Lower class people are frequently workers that cannot work at home and have to still go out and work and risk getting sick in order to make enough money for the family's necessities. As you can see in this graph, households that have an income of less than $35,000 per year have shown more COVID-19 infection rates. Many lower class people cannot afford good health care as well, so they may have a higher chance of catching COVID-19 due to the previous health conditions that have not been properly treated. I included this graph because although there were half as many cases of the virus with Black people as white people, the percent of deaths is almost the same. This could be because lower income people are frequently Black, meaning that these statistics could be because white people are getting the proper care and not having to leave their homes as much, and Black people are not, causing their amount of deaths to be high. I also wanted to mention that the U.S. has a limited amount of tests for COVID-19, and Trump and his fellow conservative allies got tested without showing any symptoms of the virus, where normal people are getting denied testings when they have all the symptoms, solely due to their age and many other factors. They think it is okay to not give people tests for COVID-19 because they are not having trouble breathing, therefore they don't need it. But these people who did not show any symptoms did need it in their point of view, which doesn't really make sense. One pandemic in history that is very similar to COVID-19 is the Spanish flu that occurred in 1918. This was a virus that spread very similarly to our current pandemic, by human contact. Just like our current situation, discrimination by race increased. Non-white people, especially Black people, did not have as much money as white people and did not have secure health care to prevent them from avoiding the Spanish flu. Black people experienced much worse symptoms and more deaths than white people who contracted the flu. In an article I read, the authors mentioned that during epidemics, the poorest of the population usually suffers the most, which is clearly being shown in the current epidemic. I simply included these two pictures because of the similarity. As you can see in both pictures, they are both wearing masks, and as you can see in this picture, it says wear a mask or go to jail, which in COVID-19, it is also a requirement to wear a mask. We can learn from the current pandemic that something needs to be done about the unjust system of many minorities that privileged people, including our leaders, don't see until times of crisis. Again, I'd like to bring your attention back to the quote I mentioned earlier. The coronavirus didn't break America. It revealed what was already broken. This really shows that the U.S. did not become more unequal with the virus, but rather it was clearly shown to us that it is indeed still there, and racism and classism still exists and is something we need to take care of. Hopefully now that this has been shown to unknowing Americans, hopefully they will attempt to push for change. Hopefully people will understand that we need to work together and help each other even after this pandemic is over. Finally, I will leave you with a quote from the same article as earlier that left me thinking. We can learn from these dreadful days that stupidity and injustice are lethal, that in a democracy, being a citizen is essential work. That alternative to solidarity is death. After we've come out of hiding and taken off our masks, we should not forget what it was like to be alone. Basically, he is trying to tell us that we need to work together in order to make the U.S. a better place for everyone, not just white people. Also, I just wanted to say, stay safe, because the COVID-19 pandemic is in fact out there, and I just wanted to make sure everyone stays safe. And these are my citations. I hope you enjoyed my story and my presentation. Thank you so much for listening.